Good evening, everyone. It's an honor to be able to address you tonight as your incoming president. The ACA is an incredible organization, and I'm very humbled by the opportunity to serve you as our leader over the next year. I'm sorry that I can't be with you in person tonight. As you may have heard, we had a small fire in our home. Everyone's fine, but I felt it was best to return after the board meeting this week to be with my family. Thanks to the miracle of modern technology, if it's working, I will at least be able to share some of my thoughts with you about the future of the college. And if it's not working, you probably got 10 minutes of Norwegian jokes from your MC. This turns out to be something that really helps me emphasize what I was already going to speak to you about tonight: the importance of being nimble and adaptive in a complex world. I'd like to begin by sharing what the ACA means to me. This has always been a very special place. Even before pharmacy school, I saw Dad speak of this organization in the highest regard. As a pharmacy student and young pharmacist, I was introduced to the college and watched Dad in leadership roles, and I began to understand the importance of the ACA as a professional and ultimately as a business owner. This is nothing new to the people in this room. Healthcare is tough. Pharmacy is incredibly challenging. Maintaining a business based on the model of community pharmacy practice sometimes feels insane. Business ownership and leadership can be lonely at times. We come here as fellows of the ACA to remind ourselves why we do it. To step away from the day-to-day chaos and share our experiences, to motivate each other, to refresh our entrepreneurial spirits, to pull the arrows out of each other's backs, to inspire and be inspired. This amazing organization is full of some incredible people. It wouldn't be possible to recognize all of the people within the college that have impacted my career, but I need to recognize a few special individuals. First, I'd like to recognize Bernie Clauda. Barney was the first person to walk up to me at an ACA meeting and take me under his wing. He remains an inspiration, and I'm forever grateful for his mentorship and kindness. Jerry Green, I'd like to thank you for your leadership and initiative over this challenging past year. Tom Hunt, for your steady hand. You've been a fantastic role model. Both of you have been wonderful mentors and comrades, and thank you for helping us set up the college for future success. Donnie Calhoun, thank you for your trust and willingness to lead this organization. Your enthusiasm and fresh eyes are sure to bring great things to the college, and I look forward to working with you for years to come. I'd like to give special thanks to Dana Easton and the ACA staff, Linda, Susan, Terry, Donna, and Ann. You are all amazing. None of this would happen without you. You've demonstrated a great deal of courage and dedication to work through change, and I'm humbled and grateful to be able to work with you. Ed Hesterly, what can I say? You've been a friend and mentor, and without a doubt, one of the most influential people I've had the privilege to know. Thank you for shepherding us through some challenging times with vision and grace. The college owes you a debt of gratitude that can never be repaid. Thank you for being my friend. I'd like to thank my partners, Scott Herzog, Brian Beach, and Ryan Hansen, as well as Roland Lopez and the rest of the team at Kelly Ross for your incredible support as I'm away working on ACA business. To my wife Jessica and our boys Johnny and Michael, thank you for your love, patience, and support. I couldn't do any of this without you. To my mentor, friend, and an eternal inspiration, Dad. Thank you for continuing to encourage and guide me here at the ACA, as well as throughout my career in life. And Deborah, thank you for your constant encouragement and enthusiasm for everything that I do. And especially thank you for helping me with tonight's gifts. Deborah helped me tremendously with arranging a small token of my appreciation for all of you this evening. A little taste of the Pacific Northwest. You should find at your table a sample of a product from Seattle that you may not have heard of, Starbucks coffee. It fuels us through the long rainy days in Seattle, and I think it's really starting to catch on. So, what's ahead of us for the ACA? I believe that our future as the ACA is really a reflection of all of our professional futures. We're living in uncertain and challenging times. It's human nature to crave stability, and it's hard to feel like we have that right now. Our worlds are increasingly complex. Change is coming at us faster than ever. We have a choice. We can stand still and yearn for the good old days and let somebody else decide our futures. Or we can take the initiative. We can build the future that we want to live in. The good news is there are things that we can control. We're trusted by our patients and our communities to be there when they need us. This is an opportunity to be the stability that people need for our patients we serve as well as each other. In order to succeed as a profession, in our businesses, as an association, we must be nimble and adaptive. We must embrace change and do our best to see around corners and capitalize on opportunities. So what might the future look like for us? In Washington State, provider status is a reality. As of January 1st of this year, insurance companies are legally required to include pharmacists as providers in their health plans. As we speak, my pharmacists are credentialed and in the process of contracting with several major health plans, and we will be billing and getting paid for our clinical services. We're building an entire division of our company around this opportunity. We're already working with a major hospital in Seattle that sees the value in our work. We built a transitions of care service that sends one of our pharmacists into a patient's home after they've been discharged from the hospital. We provide comprehensive medication reconciliation and patient education. Physicians and patients love it. The hospital, which was being penalized by Medicare for their readmission rate for their CHF patients, is thrilled. The best readmission rates in the country for CHF are around 21%. We brought Virginia Mason's readmit rate down to 8%. We're being properly compensated for our time, and we don't dispense any medications. Think about that. Think about a future that is not tied to a commodity, where you are what people value. In my practice, we're doing some really exciting things, and I don't know where we would be without the ACA. As Dad has always been fond of saying, the ACA has given us permission to be successful. Through sharing, mentorship, and entrepreneurial encouragement, we've been shown that it's okay to do well while doing good, and that we can innovate and have tremendous impacts on our communities. I see my role as president over the next year as helping prepare the college and its members for the challenges and opportunities of an uncertain future. The ACA must be nimble and adaptable in an increasingly complex landscape. We have an amazing staff at the ACA, but they can't do this alone. We're all in this together, and we need active participation from our entire membership. We need to find better ways to communicate and engage new and potential members in order to ensure that the college remains the institution that we all love. We need you all to be a part of this. I'd like to close with an inspirational thought from one of our fellows. In 2004, I was a new pharmacist attending the APHA annual meeting in Seattle, Washington. Dan Herbert, an ACA fellow, delivered an incredible speech as the incoming president of APHA. He shared something that has stuck with me all of these years. He said, "We must stop measuring our success by the number of prescriptions that we fill, but instead by the number of lives that we change." Thank you for letting me share these thoughts with you tonight and for being nimble and adaptive, and have a great evening.